Hello, everyone. My name is Abdullah Sheikh. I am from the Allegheny Health Network in Pittsburgh, Pennsylvania. And today, on behalf of all the Clout investigators, I'd like to present safety and effectiveness of the ClotTriever system for treating deep vein thrombosis. This is the 6-month outcome of the fully enrolled Clout registry. Deep vein thrombosis. The current standard of care is anticoagulation, and this has been the case for decades. Incomplete thrombus removal can lead to an entity known as post-thrombotic syndrome, characterized by swelling, pain, heaviness, cramps, eventually chronic pain, and the dreaded complication of leg ulcers. Eventually, this can lead to long-term disability as well, straining the healthcare system. Mechanical thrombectomy is being increasingly utilized for interventional thrombus removal in DVT patients. However, more data on longer-term outcomes of mechanical thrombectomy are needed. The ClotTriever system. On the right, you've got the ClotTriever sheath. This is available as a 13 and 16 French sheath. On the left, you've got the ClotTriever catheter, which works over an 035 wire. This goes through the sheath. It has a nitinol coring element, which is unidirectional, and a collection bag distal to the coring element, which traps the thrombus as it gets collected during the pullback. The ClotTriever system is a mechanical thrombectomy system designed to extract large thrombi from large vessels without thrombolytics. The Clout Registry, the largest mechanical thrombectomy study in the field of DVT. The design was a prospective, multi-center, all-comer, single-arm study. The objective, well, what really happens to these patients over a course of 2 years? We treat them, and what happens? The primary endpoint, complete or near complete removal of thrombus by core lab assessed Marder score. So there were 500 patients enrolled across 43 US clinical sites. After enrollment, one patient was deemed ineligible per study criteria, and therefore that left an analysis of 499 patients in the population. At 6 months, we have about a 76% follow-up rate with 378 patients remaining, with ongoing 1 and 2 year follow-up visits. Baseline characteristics. At the subject level, the most important point here is that almost about a third of these patients had a contraindication to thrombolytics, so they may not have received anything more than an IVC filter. At the limb level, 40% of these patients had a provoked DVT. About a quarter of these patients had a prior treatment before coming for mechanical thrombectomy. And the location of this thrombus, almost 80% were in the iliac or iliofemoral region. And when you look at the age of the thrombus, as examined on the back table, you could see it was almost evenly distributed, with about 30% being acute, 34% being subacute, and 36% of the thrombus removed being chronic. Procedural outcomes. We all know that ClotTriever is known for a single session therapy. However, the median number of device passes was 4. Median procedure time 65 minutes, with an actual thrombectomy time of only 26 minutes. Very minimal blood loss at about 40 ml. Only 2 patients required adjunctive lytics. Stenting was performed in 44% of the patients. And interestingly enough, median hospital stay, 1 day. Post-procedure ICU stay, only 11 patients went back to the ICU, but that was because they were coming from the ICU for other medical reasons. Effective thrombus extraction. Marder scores assessed by an independent core laboratory. Pre-thrombectomy venograms had a calculated Marder score of 8.8. Post-thrombectomy venograms showed a Marder score of 0, which was deemed statistically significant. So what that means is in 91% of the patients, more than 75% of the thrombus was removed. In 71% of the patients, more than 90% of the thrombus was removed. And there was about 100% thrombus removal, only 64% of the patients. So that translates to nearly 2/3 of the patients had 100% thrombus extraction. Favorable safety profile at 30 days. Events were adjudicated by an independent medical monitor. There was an all-cause mortality rate of less than 1%. Serious adverse events, 8.6%, and a rethrombosis rate of only 4.8%. PE was less than 1%. However, there were no reports of acute kidney injury, valve, or any vessel damage. There was one device-related SAE, which was deemed to be avoidable and based on operator error. Rethrombosis residual thrombus SAEs through 6 months. This is again adjudicated by an independent medical monitor. We have a Kaplan-Meier analysis. So at 30 days, the rethrombosis rate is 4.8%. And at 6 months, this increased up to 8%, which is most likely due to non-adherence to medical management or being non-compliant. Restored flow through 6 months. Duplex ultrasound outcomes. On the left, we look at flow. We've got 27% of the patients demonstrating flow in the treated limbs. At 30 days, flow is maintained in that limb in 85% of patients and increases to 93% of the patients at 6 months, and this is deemed statistically significant. When you look at compressibility, the percent of limbs with normal or partial compressibility at baseline was only 28%. However, this increased to almost 88% at 30 days and 92% at 6 months. Again, statistically significant. So radiologically, treatment is sustained out to 6 months. Venous disease severity through 6 months, Villalta scores and PTS. The median Villalta score at baseline was 9 for these patients. This improved to 3 at 30 days and down to 1 at 6 months, an 82% decrease, and again, statistically significant. Venous disease severity through 6 months, Villalta scores and PTS. The median Villalta score at baseline was 9 for these patients. At 30 days, this improved to 3 and continued to improve at 6 months down to 1. That was an 82% decrease from baseline and statistically significant. On the right, when you look at the change in Villalta score or PTS severity categories, as you can see at baseline, there was a wide spectrum of very little to mild symptoms to moderate to severe symptoms and signs. At 6 months, 76% of the patients have no PTS. That means that 23% of the patients did have a degree of PTS. This translates to 92% of the patients improved in severity category or remained in no PTS. Patient-centric improvement sustained through 6 months. So how do the patients feel is what this slide is all about. On the left, we've got the VCSS, and at baseline, we've got a score of 6. This improved to 3 at 30 days and stayed at 3 at 6 months, a 50% reduction and statistically significant. Numeric pain rating score was 5 at baseline, 0 at 30 days, and sustained at 0 at 6 months, a 100% reduction and statistically significant. Quality of life scores, baseline of 0.69 and up to 1 at 6 months, a 27% increase and statistically significant. In conclusion, the real-world Clout results demonstrate unmatched efficiency and effectiveness. 91% of patients received complete or near complete thrombus removal. There was very minimal blood loss with only 40 ml median estimated blood loss and very little lytic use. At 30 days, an excellent safety profile was observed. A 0.2 device-related SAE and a 4.8 rethrombosis residual thrombus SAE at 30 days. For the patients, positive clinical benefits were achieved out to 6 months. 91% of the patients with no or mild PTS, pain scores improving to 0 with a 100% reduction, and a quality life score improving to top the score of 1.0. Thank you on behalf of all the Clout investigators across the country who helped participate. And finally, I'd like to draw your attention to the recently announced randomized controlled trial called Defiance. Defiance is looking at ClotTriever versus anticoagulation in deep vein thrombosis. 300 patients will be enrolled in a 1-to-1 ratio for randomization, with the primary endpoint being occurrence of treatment failure or therapy escalation, and assessment of PTS severity as defined by Villalta scale at 6 months. Stay tuned in the future for data releases regarding this. Thank you.